Diabetes complications. Let's get serious about diabetes. Welcome to the Health Life YouTube channel. Diabetes can lead to severe and, in some cases, life-threatening complications, but you can lower your risk of diabetes-related complications like heart, kidney, and eye disease by making healthy lifestyle changes, knowing the warning signs, and attending regular visits with your healthcare provider. Diabetes complications explained. Diabetes increases your risk for many serious health problems. The good news? With the correct treatment and recommended lifestyle changes, many people with diabetes are able to prevent or delay the onset of complications. 1. Diabetes-related eye disease. Diabetes is the leading cause of new cases of blindness in working-age adults. Learn how routine comprehensive eye exams can provide early detection and prevent or delay vision loss and other valuable information to help avoid diabetes-related eye disease. Diabetes is the leading cause of vision loss in people 18 to 64 years old, and there are no obvious signs or symptoms. But the great news is, an annual routine eye exam can help identify existing eye disease so you can take steps to prevent or delay vision loss caused by diabetes. People of color are at a greater risk of going blind from diabetes. Diabetes retinopathy is a leading cause of blindness in American adults. The number of individuals with diabetic retinopathy is predicted to increase by 48% by 2030. 2. Foot complications. Learn about diabetes-related foot complications and how you can treat and prevent them. People with diabetes can develop many different foot problems. Even ordinary problems can get worse and lead to serious complications. Foot problems most often happen when there is nerve damage, also called neuropathy. This can cause tingling, pain, burning, or stinging, or weakness in the foot. It can also cause loss of feeling in the foot, so you can injure it and not know it. Poor blood flow or changes in the shape of your feet or toes may also cause problems. Take good care of your feet and see your doctor right away if you see any signs of foot problems. Take care of your feet. When you have diabetes, caring for your feet is very important in avoiding serious foot complications. Take care of your feet by doing the following. Wash your feet thoroughly every day. Dry them thoroughly and don't forget to dry between your toes. Moisturize your feet but avoid moisturizing between your toes. Keep your toenails trim and use an emery board to file down sharp edges. Check your feet for sores, cuts, blisters, corns, or redness daily. Let your doctor know if you find any of these. Wear moisture-wicking socks. Before putting your shoes on, check for sharp objects, i.e. small rocks. Wear shoes that fit well and don't rub your feet. While you're at it, avoid these. Don't walk around barefoot. Don't soak your feet. Don't smoke. 3. Oral health. Your mouth doesn't lie. Swollen, bleeding, or receding gums, loose or missing teeth, and persistent bad breath are all signs of gum disease. If you have diabetes, you're at higher risk for both gingivitis, early-stage gum disease, and what's known as periodontitis, advanced gum disease. Both start with plaque, a soft, sticky substance that accumulates on your teeth as you eat and is made up mostly of bacteria. More than 500 types of bacteria can be found in plaque. Some are good for your mouth and some aren't. Bacteria in a person with diabetes is no different than people without doesn't have diabetes. The difference is in the nature and intensity of the body's inflammatory response to the bacteria. If you have diabetes, especially if you're not meeting your targets, you will have more of an inflammatory response, which could result in a loss of supporting tissue for your teeth. Eventually, the tooth could become so loose it has to be removed. There are some oral conditions that are more common in people with diabetes, such as dry mouth. It may be a result of aging or medications, but it could also be a complication of diabetes. Whatever the cause, the lack of saliva from dry mouth means food debris, sugar, acid, and bacteria don't get washed away as easily. There is good news, though. None of this happens right away, and there's plenty you can do to prevent gum disease. If you manage your diabetes and your oral health by getting regular checkups with a dentist or periodontist, you will reduce your risk. 4. Get serious about stroke prevention. If you have diabetes, your chances of having a stroke are 2 times higher than in people who don't have diabetes. Learn how to lower your risk. Living with diabetes heightens your risk of getting a stroke. Not everyone with diabetes will get a stroke, and there are steps you can take to make sure you're one of them. Understanding your risk factors, implementing healthy lifestyle changes, keeping tight blood glucose, blood sugar control, and more will all lower your risk of ever getting a stroke. 5. Cardiovascular disease. People with diabetes are twice as likely to have heart disease or a stroke than people without diabetes. Learn how to stay heart healthy to reduce your risk. Of diabetes complications, this is one you want to pay close attention to. Cardiovascular disease, CVD, where the heart and blood vessels are negatively impacted, is the #1 cause of death in people living with diabetes, resulting in 2/3 of deaths in people with type 2 diabetes. And on top of that, people with diabetes are twice as likely to have heart disease or a stroke than people without diabetes. However, there is good news. With proper exercise, diet, and diabetes management, you can reduce your risk of getting CVD and the complications that come with it. Watch out for the symptoms of CVD: shortness of breath, fatigue, pain in your chest, angina, throat, back, legs, neck, jaw, upper abdomen, arms, weakness or numbness in your arms or legs. 6. Understanding neuropathy and your diabetes. Nerve damage from diabetes is called diabetic neuropathy, affecting about half of all people with diabetes. If you have diabetes, this should be on your radar. Neuropathy, is a diabetes complication that causes nerve damage throughout your body, and if left untreated has the potential to lead to infection and/or amputation of the affected area. About half of all people with diabetes have some form of nerve damage, but don't panic. Neuropathy is not inevitable. Keeping your blood glucose, blood sugar levels on target is your best line of defense against neuropathy. You can also manage neuropathy through a healthy diet and consistent exercise routine that fits your lifestyle. 7. Diabetes and hearing loss. If you live with diabetes, you are twice as likely to experience hearing loss. Learn the early signs and what action you should take. Diabetes and hearing loss are two of America's most widespread health concerns. More than 38 million people in the United States have diabetes, and a recent study found that hearing loss is twice as common in people with diabetes as it is in those who don't have diabetes. Also, of the nearly 98 million adults in the United States who have prediabetes, the rate of hearing loss is 30% higher than in those with normal blood glucose, blood sugar. Right now, we don't know how diabetes is related to hearing loss. It's possible that the high blood glucose levels associated with diabetes cause damage to the small blood vessels in the inner ear, similar to the way in which diabetes can damage the eyes and the kidneys. But more research needs to be done to discover why people with diabetes have a higher rate of hearing loss. Since it can happen slowly, the symptoms of hearing loss can often be hard to notice. In fact, family members and friends sometimes notice the hearing loss before the person experiencing it.